Data show Canada's first dose fast strategy is working. Relatively few COVID cases have been reported after one jab, and the hospitalization age has fallen. Teens are also getting immunized.
After I get my vaccine, I know that I'm protecting the people who are around me every day.
But the opposition criticises the government for taking doses from the COVAX facility, set up to benefit poorer nations, and not using the hundreds of thousands of Astra-Zeneca jabs that other countries could make use of. The criticism got loud when it was revealed Canada signed enough supply contracts to vaccinate every citizen 10 times over. We'll talk to a Canadian doctor about that in a moment. First, more on the quest for neighbourly love coming from the other side of the border with the United States.
They're among the unsung heroes of the pandemic, the truckers, transporting goods back and forth between the US and Canada. One of them is Adam, driving from Winnipeg in the Canadian province of Manitoba, right across the USA.
I'm always driving into the hot spots, into hot cities, going into truck stops where there's guys from all over North America there as well too, and we're all within 6 feet sometimes. So yeah, surprisingly that we haven't been the ones spreading it around.
First, Adam heads to the depot to pick up his load. This time it's potato fries for Texas. His boss comes out to wish him luck. Today's a very special trip for Adam. He's going to get vaccinated against COVID-19 in the US.
How does that make you feel?
I'm actually quite excited about that. I've been hoping to get it for some time now. My wife has been vaccinated already, first and second, because she works at the hospital. So it was hoping for a matter of time that I can get mine.
The border between Canada and the US has been closed for over a year, but truckers transporting essential goods have been allowed to cross, even without a vaccination. But now help is waiting for the Canadians in Fargo, the first major stop on the American side. People here are happy to share.
We have extra vaccine in North Dakota, and so if people want to be vaccinated, I'd personally welcome them all to come and get it here if they choose.
Sure, that makes sense. If they're going back and forth a lot and vaccines are available, you might as well get it to as many as you can.
Sure, why not? I think it's a good idea to get it out to as many people as possible.
Canadian truckers can take the next highway exit and head for this rest area, where they can get vaccinated Wednesdays to Fridays. The inoculation comes just in time for Adam. Canada is currently in the grip of a third wave, and the risk for truckers is growing. Adam has nothing but kind words for his neighbours.
Thank you for this cooperation. Like, seriously, coming together like this for truckers is a big plus for sure, because sometimes it feels that we're the forgotten front line for sure.
Inoculating Canadians on US soil is the only way of getting around the US ban on vaccine exports. Next up, it'll be the teachers. Here in North Dakota, the America First mentality has given way to putting neighbours first.
Noni MacDonald is a professor of paediatrics in Canada. As we heard in that report, we see truckers going across the border to get their immunisation, although Canada seems to have quite a lot of doses itself. How would you rate Canada's vaccination drive in all?
Actually, it's been very good, Ben. Of the doses that we've received, and it's a large number, 20-some million, more than 89% have been distributed to the provinces and territories across the country. And in most of those provinces and territories, more than 80 to 90% are already in arms, already immunized.
So you wouldn't agree with the criticism from abroad that there's been a disproportionate vaccine intake in Canada, like some other OECD countries as well?
So we have more orders for vaccines than we have population, but whether all those vaccines will arrive is not even clear at this point. So as an example, we have large orders in for Moderna vaccine, but it's not coming. As you know, there have been real problems in delivery of Moderna. So Canada's decision had been to order from a number of different countries in case there were delivery problems. So it's always different what you've ordered and what you actually get. And, you know, if we were going to look at who has had the most vaccine, well, it would be Israel by population.
Sure. Canada's been following a different strategy, though, a single-dose COVID-19 vaccine strategy. Is that working? I mean, they're telling some people to wait so much longer than others, in some cases up to 4 months.
Yeah. So what happened is the chief public health officer for British Columbia was the first one who really pushed for the single dose. She was extremely worried. They have large numbers of seniors proportionately in that province. And she wanted to make sure that all the seniors, all those over 65, got at least one dose as opposed to waiting and to get any dose. And then that was picked up across the country. Well, actually, she was really quite prescient because we now have data to show that with the vaccines that we have, both the mRNA vaccine and the viral vector vaccines, waiting longer than your 4 weeks actually is better because the second dose is actually a boosting dose. Your rates don't go down rapidly after you've had your first dose. In Canada, what this has meant with our third wave of COVID, we're not seeing senior people that are over 65, 70, 80, and 90 in the hospital, those that have been immunized. They're just not there. Our average age in the hospital now is in the 50s with this third wave because all the ones above it have been well immunized. In my province, those between 75 and 79, 99% have received at least one dose. They're not getting sick. The vaccine's working.
Another point of contention, mask policy. What do you think about that as far as people who've already had the virus or have been vaccinated?
In terms of there being what they can do now?
Exactly, in terms of having to wear one or not.
Yeah, there's been a big controversy about masks. As you know, the Center for Disease Control in the U.S. said if you've been immunized with 2 doses and or you've had disease, you're fine, you're good to go. You can go into any restaurant or any bar or amusement park or sports event. Canada's been much more quiet about this. Number one is most of our people have only had 1 dose. They'll have had a second dose by the summertime, but only 1 dose so far. Second one is, how do you know who's had vaccine and who has not? And is this discriminatory about your being able to do this? Because we do know, even if you had 2 doses of vaccine, it doesn't prevent you from being colonized and having asymptomatic infection with COVID and then taking it back out into the community again. So Canada's being much more cautious than the U.S. On a sidebar to that, the U.S. thought that this might increase people's vaccine acceptance because, hey, I could now do more things if I was immunized. We've not used that as a strategy because right now surveys have shown well over 80% of adults in Canada from 20 years on up want to get vaccinated, and a very high percentage already are. We're already ahead of the U.S. in terms of those who've actually had 1 dose of vaccine. So we don't see it as the same issue as they do, and we don't think it's a really good strategy.
Really briefly, just a yes or no, Noni, you've had both jabs. Your husband's had 1 jab so far. I've had 1 as well. Do you finally see some sort of light at the end of the tunnel?
Yes, I do. If you look at the countries where they have very high percentages of people like Israel and the UK who've received 1 or 2 doses of vaccine, they are not having the same problems with the third wave of COVID. And there will be a 4th wave and probably a 5th wave. So, yes, it's really effective.
Noni MacDonald, thank you very much for being on the show today.
You're welcome.
Now here's a viewer question Noni touched on there. Let's see what Derek has to say about it.
If you're fully vaccinated, can you still carry the virus and spread it to others?
This issue has really been a top drawer concern among health authorities for months, but we now know that so-called breakthrough cases, which is when someone tests positive for COVID-19 even after full vaccination, that they're actually really quite rare. We also know that many of the authorized vaccines are extremely effective at preventing serious disease in those rare breakthrough infections. A number of studies have confirmed that if you're fully vaccinated, the chances are more or less zero that you'll be hospitalized or die from COVID-19 if you end up contracting it anyway. Still, the worry about vaccinated people catching and possibly transmitting the virus to others, that's persisted for months, while the data has slowly built up about exactly how much of a danger they really pose. For the Centers for Disease Control in the US, the data is now convincing enough to have real-world consequences. In a move that took a lot of experts by surprise, America's Public Health Agency earlier this month changed masking guidelines. It now says that fully vaccinated people can feel free to go without a mask in most situations because enough studies, like this one from Israel, show that the number of breakthrough cases is indeed very low, and the chances that those individuals might transmit the virus to others is extremely low as well. That's kind of an about turn, and it's really sparked some controversy. Some experts don't like it or agree with the agency's decision, but I think it's fair to say that the evidence is quite strong now that if you've been vaccinated, fully vaccinated, with one of the highly effective vaccines and waited for a couple of weeks, then you're unlikely to carry the virus or to spread it to others for at least a few months after vaccination.
Derek Williams there, I'm Ben Fazul, and thanks for watching. Stay safe and see you again soon.